My name's JB, and today I'm going to talk about the sequence for putting on and removing personal protective equipment or PPE. This topic will be very helpful when you're working in a certain facility or you will be taking your NCLEX-RN or PN. This is from the Centers for Disease Control, which is the National Public Health Agency of the United States of America. So let's get started. This is the sequence for putting on personal protective equipment or PPE. The type of PPE used will vary based on the level of precautions required, such as standard and contact, droplet, or airborne infection isolation precautions. The procedure for putting on and removing PPE should be tailored to the specific type of PPE. First, for donning, which is putting on, first we have the gown, the mask or respirator, goggles or face shield, and then gloves. So that's GMGG. So the first thing that you wear when putting on is the gown. It should fully cover the torso from neck to knees, arms to end of the wrists, and wrap around the back. Then fasten in back of neck and waist. So this is the picture on how to put the gown. And then the second equipment you need to put on is the mask or the respirator or the N95 respirator. Secure ties or elastic bands at middle of head and neck, which is in this picture. Fit flexible band to nose bridge. Fit snug base and below the chin. And fit check respirator. Usually your respirator, your N95 respirator will be measured according to the size of your face because it needs to be closed when you're going inside, especially with airborne precautions, so that those organisms cannot enter or you're not going to inhale those organisms. And then the third one is goggles or face shield. You have to place over face and eyes and adjust to fit. This is how you do it, the picture. And then gloves, extend to cover wrist of isolation gown. So this is how you put your gloves. You have to use safe work practices to protect yourself and limit the spread of contamination. So you have to keep hands away from the face, limit surfaces touched, change gloves when torn or heavily contaminated, perform hand hygiene. You must wash your hands, which is a standard universal precaution before doing anything. So, how to safely remove personal protective equipment or PPE or your doffing procedure. Putting on is donning, removing it is doffing procedure. There are a variety of ways to safely remove PPE without contaminating your clothing, skin, or mucous membranes with potentially infectious materials. Here's one example. Remove all PPE before exiting the patient room, except a respirator if worn. Remove the respirator after leaving the patient room and closing the door. Remove PPE in the following sequence. Remove first the gloves, then the goggles or face shield, the gown, and the mask or respirator, and then you have to wash your hands after. So it's GGGM and then wash hands. So gloves. Remember that outside of the gloves are contaminated. If your hands get contaminated during the glove removal, immediately wash your hands or use an alcohol-based hand sanitizer. Using a gloved hand, grasp the palm area of the other gloved hand and peel off first glove. This is how you do it. The first drawing. Hold removed glove in gloved hand. This is it. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove. And then Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove, and then discard the gloves in a waste container. This is it. And then goggles or face shield. Outside of the goggles or face shield are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hands or use an alcohol-based hand sanitizer. Remove goggles or face shield from the back by lifting the headband or ear pieces. So this is how you do it, as you can see on the picture. If the item is reusable, place in designated receptacle for reprocessing. Otherwise, discard in a waste container. Next, the gown. The gown front and sleeves are contaminated. Remember that. If your hands get contaminated during gown removal, immediately wash your hands or use an alcohol-based hand sanitizer. Unfasten gown ties, taking care that the sleeves don't contact your body when reaching for ties. And then pull gown away from neck and shoulders, touching inside of gown only. Turn gown inside out, and then fold or roll into a bundle and discard in a waste container. So this is how you do it. Step 1, Step 2, Step 3. As you can see on the picture. And then for the mask or respirator, the front of mask respirator is contaminated. Do not touch it. If your hands get contaminated during mask respirator removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp the bottom ties or elastics of the mask respirator, then the ones at the top, and remove without touching the front. So this is how you do it. See on the pictures. Then discard in a waste container. And then last but not the least, you need to wash hands or use an alcohol-based hand sanitizer immediately after removing all PPE. If you're going inside a room with a contact precaution such as Clostridium difficile or diarrhea, you need to wash your hands, not alcohol-based sanitizer. You need to wash your hands after. That's a standard precaution. So you need to perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE. Just for a quick recap about donning and doffing your PPE or personal protective equipment. So when you say donning, safely putting it on. So the sequence would be wash your hands, that's a standard precaution, and then put on the gown, the mask or respirator, the goggles or face shield, and then the gloves. That's for donning. And then for doffing or safely removing it, the sequence would be remove the gloves first, and then goggles or face shield, and then the gown, and then the mask or respirator, and then you have to wash hands with soap and water or hand sanitizer, but it is recommended to use soap and water. I hope this was helpful to you. Please like, comment, and subscribe. See you in the next video, and happy nursing. Bye.